Ravindra, Nikita, then Akshay, Mohammed Oswald, Owen, okay, sorry. Dr. Ethan, Nivita, Chinmay. Opposite team, Morgan, Alinda, Dr. Shashwat, then we have Varun Kashyap, Lipika, Surabhi, Lekhan. Okay. ಇವಾಗ ಫಸ್ಟ್ ಟೀಮ್ ಇಂದ ಫಾರ್ ಅಂದ್ರೆ ಏನೇ ಒಂದು ಫಾರ್ ಮಾತಾಡೋಕ್ಕಿಂತ ಮುಂಚೆ ಏನು ಅಂತ ನಮ್ಗೆ ಗೊತ್ತಿಲ್ಲಂತೆ ಅಪೋಸ್ ಆಗೋದಲ್ಲ. ಸೊ ವಿಷಯ ತಿಳ್ಕೊಳ್ಳೋಕ್ಕೋಸ್ಕರ ವಾಟ್ ಈಸ್ ಆರ್ಟಿಫಿಷಿಯಲ್ ಇಂಟೆಲಿಜೆನ್ಸ್, ಅದು ಏನು ಅಡ್ವಾಂಟೇಜು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಪರವಾಗಿ ಡಾಕ್ಟರ್ Ravindra will be talking.
Good morning to all of you. We are team diagnosers. We named ourselves like that because we are the ones who are going to look back into the future. So first of all, to start, so what is AI? AI refers to a set of methods and algorithms used to develop intelligent systems that can perform tasks requiring human-like intelligence. So this includes, this is basically like you ask a machine to do things that a human can do. Something like problem solving, visual perception, speech recognition, language translation, task completion, and all that. So, coming to a small quote about the usage of AI. So, according to Benjamin Bell, who is a famous Scottish surgeon, he says that AI will not replace doctors, but instead will augment them, enabling physicians to practice better medicine with greater accuracy and increased efficiency. And to start our first offense statement, there was a research conducted in 2000 where a competition was conducted for the diagnosis of breast cancer, and the competition was like people had to come up with an AI algorithm which can diagnose breast cancer. So the best algorithm that came there was proven to outperform a pathologist. So that is our first offense statement.
All of you have to train your team before.
My name is Dept. So coming to the benefits of AI in diagnosing pathology, so it helps in streamlining workflow. It reduces physician handling and errors. So here slides are digitalized, which enables to access slides directly from the workstation, reducing time of retrieval and to prepare them. It helps in annotating capability. So it helps to communicate and consultate among pathologists and other departments, so which prevents diagnostic errors. It allows to share high quality images among pathologists worldwide. If a patient has to go for a second opinion, so the image can be shared directly instead of carrying the slide and like there might be a damage or there might be some things. So to prevent that, the image can be directly sent. It opens opportunities to apply machine algorithms to detect patterns or abnormalities that is overlooked by human observers. So if there is something which is overlooked, that can be stored in the AI and that can be like searched in the AI and it could be found out with it.
So you mean AI is good?
Yes sir. It is.
So any counter answer from the opposite group?
So he's telling.
And tell your names.
Ethan sir.
Ethan. So Ethan Misha tells it reduces the time for the pathologist and even the quality of the report is not compromised.
Yes sir.
Yeah. So any counter answer from you? Tell your name.
Good afternoon all. I'm Varun Kashyap.
Yeah.
So we named our team Morgagni. This is after Giovanni Morgagni, the father of pathology, and this is our way of paying tribute to all those pathologists who have to go through thousands of slides, have to correlate with clinical findings, look at biochemical reports, and then come to a final diagnosis. So the point I'm trying to make here is, a diagnosis is multifactorial. It is not based on one single FET criteria that an AI works on. And the first argument about the competition, a competition is a controlled environment wherein the set of circumstances are predetermined, and all that happens over there is based on pre-fed data. That is not how a real life diagnosis works. Here you are working with the unknown and you are trying to get to something which is known, and that is something where a human expertise always comes into play. Something as complex and as vertically evolving as the human body requires a human touch to understand it. It requires a human to go through all the findings, look at the pathological tests, and then arrive at a diagnosis. So So this is where a human expertise outperforms an AI.
But
He also talked about sharing name.
just a minute.
Varun Kashi.
So Varun, you are telling that you just highlight important. So it's a multifactorial.
Multifactorial diagnosis, which
So we need
a human touch, and human body is consistently evolving. So humans understand it best because AI works on pre-fed data, whereas human intelligence is also evolving along with our evolution.
But nowadays the clinician won't report within half an hour, 1 hour. What to do? In fairness,
Varun BS. So he talked about sharing images. I don't think you require AI to share images. You can share high resolution images anywhere around the world. That was one point. And while he was talking about the competition, he was talking about one pathologist. While giving reports, we have seen that there are multiple pathologists who are looking at the same slide, and there's discussion among them, which not only enhances their knowledge. Discussion and debating is a proven method where you can reduce the number of errors in clinical diagnosis.
Need special technologies only to send that. It cannot be sent like WhatsApp messages like how we send normally. So those are actually high quality images.
I am Akshay. So he said that pathologist is required for diagnosing each and every slide. So for example, if you have 100 slides, histopathologist slides, will it take so much time for you to, are you free first of all to diagnose each and every slide?
That's your job.
Wait, I am coming to it. Yeah. First of all, if we invest on one AI tool machine, so that we can save lot of money. Like for 100 slides, if one pathologist can diagnose 10 slides at one day, then we require a 10 pathologists for diagnosing 100 slides. So instead of that, if we invest that money on the AI, then we are able to save lot of money and lot of time, and we can better utilize those resources in wherever it is required. According to the AI tool management, so the three principles that are required in AI are transparency, guidance, and whatever the ultimate cost of it should be reduced. So the ultimate aim of introducing AI in the pathology is to serve the pathologist in a better manner. It doesn't mean that the AI will replace the pathologist. For example, introduction of phone pay. You know that when we introduced UPI apps, everyone started paying using UPI. But did the value of a note, 100 rupees note or 1000 rupees note got lost? No, right? So if I throw a 100 rupees note on the floor, there are many people to come and pick it because it has the value. In the same manner, the pathologist also has the same value. In spite of having AI as a betterment tool for the pathologist in diagnosing a disease.
My name is Jesslyn. Like you said about the magnification, like when you send images, with AI we can like magnify the image. Like whenever you want, you can set into a 40x or 100x, or instead of manually doing it in a microscope, you can zoom in, zoom out at your own pace. And in terms of like you said that errors, there are chances like with pathologists errors can happen, human errors in handlings, especially in a streamlined workflow. Like there could be a possibility you can lose the slide, or there is some microorganism or then some artifact. The AI has the capacity to even detect that. It is called as explainable AI, where the AI will even say how it came to a diagnosis or how it detected if there is any artifact or microorganism or anything like that. So it is definitely proven that with AI, it can surpass the human errors, what will happen, and we will even get to know if a staining is done properly or what the error went there.
My first rebuttal would be, what he pointed out is you have many cases to go through. So basically he's talking about the corporatization of healthcare system, where you have a target to meet, where you have a percentage you have to diagnose, and that is not good for the present healthcare system. Do you want to look at 100 patients and get 80% of them right and the other 20%? Those 20% are patients' life that matters, and you cannot have a wrong diagnosis.
Just like you gave the 100 rupees note example, will you go for it if I put a 1000 rupees note? Not anymore, right? Similarly, we also keep evolving. Pathology keeps evolving. Our intelligence keeps evolving. Everything in AI works on pre-fed data. So you need to feed that data. So only once you realize that note has no value, will you be able to feed that data somewhere. So it's more of the pathologist's intelligence over here.
Hello everyone, I'm Shashwat. Sir, you asked about rural setups and that clinicians want their reports right now. Clinicians want their reports fast, not 5-6 days later, yes? So all this, implementing AI into our current hospital setups, primary to tertiary, is a very hard and challenging task. The current system which we are using in pathology has been developed over many years. Many mistakes have been made, and now this is the best we can do right now. Now to uproot that and implement the new system to which I think we are alien. Indian hospitals still to this day are using pen and paper for requests for many things. The first challenge would be to add a cloud system. That in itself would take many years. Cloud system technology advancement came in 2006. We are in 2023 right now. Do we have a cloud server for our pathology department? No. So these things take time and a lot of cost, which I don't think Indian hospitals are ready to assume at this state.
And one thing I would like to highlight, myself Lekhan, and Akshay was saying that instead of investing on 10 pathologists to save the time, if we invest on AI, we could save the time. Pathologist's job is not just to identify the slides. We can see in our own college that pathologists also teach and train other people. Just by investing on AI, you can't teach and train and enhance the further upcoming pathologists. We can see in our college only how teachers train as well, and future pathologists can be come out.
Your name is Lekhan.
See, Lekhan sir, you said that there are pathologists and we don't want to invest on the AI. Does it mean that in our college also we are not taking the support of the AI tools and like computers for diagnosing a disease? See, if we have a slide, we can rotate it in many manners, like 360 degree, and we can view it in any angle. So this is possible only with AI. You can't.
You can do it with machine learning.
Machine learning is a part of AI.
Yeah.
No, machine learning makes up AI.
See, AI is how you communicate with the machine, right? If the machine knows what to do, then only you can say what the machine has to do, right?
That's not
So,
kind of our point.
see,
That's what we're trying to do.
right.
Yeah.
See, when we come to the rural setup, you can't make more pathologists to stay over there. How many of you agree that? How many of you agree that in our country, in the rural setup, there is one pathologist in every CHC or the PHC? How many of you agree? The recent updates say that there is a lack of pathologists and even the doctors in the rural setup for diagnosis of a disease. So in that way, we can introduce AI and we can make we can train a healthcare setup, healthcare worker to work on that machine, and he can also diagnose a disease. But he has to be given a proper training. That's it. The matter is.
My friend, that is policy, not medicine.
Okay, sir spoke about the pathologists and the medical community accepting the invasion of AI into pathology. It will take time, Ravindra. So we are changing. Let's say when artificial reproductive techniques were introduced, not everybody accepted it in the first time. After after a long time where they understood the benefits of ARTs, only then people started taking it up. Similarly, once people understand the benefits of AI and its integration with pathology and healthcare, people will obviously start opting for AI, and people will start will want to make their lives easier. We're not telling that the quality is compromised or the competence is compromised. We're just telling this is like another tool. Just as a mathematician uses a calculator, or like how we have an Excel program instead of pen, paper and calculator to make things easier, AI is another tool to augment pathologists with their existing work.
In cases of remote places where pathologists can't reach, it's not just about this college or any college in Bangalore. I'm talking about across the globe. Like in Africa or in US, if you see, there are still backlog for reports to be printed. Like we get it here in 24 or 48 hours. There they're waiting for reports. So if we have a machine there sitting here in India, we can report. Like if you, it's like why be selfish? Why be a selfish pathologist with a microscope when you can be a selfless pathologist with digital pathology? Like you can help so many people across the globe, and it's not like a job is going to go, because there, if you see the amount of slides to be seen and the number of pathologists, there's a huge number. And still, in cases where if there's a cancer case or there is AI can detect things early, like you can at an early diagnosis we'll get to know what's happening. And in that moment, we can actually initiate early treatment, and it's overall benefit for the healthcare. Like you can put 100 slides at a time in a scanner and see. Like instead of sitting once, like if it's a complex case, and it's a highly complex case, and the pathologist is spending 40 minutes, you can give it to AI. AI will calculate and give it. Like you can rely on it. And whatever the AI is doing is something algorithm which is generated. It's just like a helping tool. Like if you put in Excel 2 plus 2, it will give 4. But if you put 2 plus or into something else, it won't give the answer. It is only trained to give what it is right. So even if you give multiple patterns or examples to the AI, it's getting trained and it will definitely give a diagnosis.
I'm Chinmay. The diagnosis which is given by AI is proven, and it will tell why it has given that diagnosis with the proof.
Myself, Surabhi. The point that was made about AI being used worldwide, the hospitals, different geographical locations could have different providers, different software, and they might have fed different things into the AI. And it is not generated, it is generated when you feed. So it depends on what you feed. And the point you made, ma'am, about it generating what is fed into it. So different hospitals, different servers might feed different things into the software. And again, geographical locations, one of the facts that I have is Oncotype DX predicts risk poorly when applied to breast cancer specimens from African American black women. So it being used worldwide is it's not advantageous at all.
So you spoke about using AI in remote areas. There is a difference between possibility and feasibility. What you told is the possibility. Feasibility, who is going to sponsor it? Are the national policies right now in support of something like that, or are there more important things we are taking care of right now? In remote areas where the basic resources are lacking, I don't think anyone will voluntarily go and invest in something like this. And this is something which is largely privatized. You can't expect government funding over here. That is not what primarily they will be looking for. And when it comes to the cost, you said implementing AI in remote areas would be better than having pathologists. How much do you pay a pathologist? How much one time will you have to invest for an AI? It takes millions of dollars. And it takes billions of data to be fed, and all that takes a lot of time. You're selling us a future, you're asking us to believe in a future, which is right now only based on proof of concept theories being implemented in specific controlled environments.
I would also like to point out the fact that it took about 7 years, 125 billion pre-compiled datasets, along with $11 billion to develop ChatGPT. And at best, it writes you poetry. Now we are talking about pathology here, where there are many grey areas. As you pointed out, yes, 2 plus 2, it gives an answer of 4. But in medicine, we agree that there's a lot of grey areas. We don't know if 2 plus 2 equals 4. There, human intuition comes into play. Human experience comes into play. It's not always analytical in nature. That's what an AI does. And also one more thing, diseases are endemic. For example, Japanese encephalitis is endemic in Mandya. So to detect those cases, you have to feed the data of Japanese encephalitis to the AI. if you don't have enough resources, enough data to train it, how are you gonna use it for further diagnosis when you don't have enough data to train it?
So we've been talking about the advantage. So myself, Lipika, we've been talking about the advantages of AI and how it's going to help and better the medical services. But what about data privacy and security? We have been taught over the years and also been told by our teachers that it is at most important to keep the data of patients with diseases such as AIDS and all to private and not to leak out the data. In AI, it is very easy to breach the data and they can be used for any cyber malpractices as well.
So one of them spoke about standardization of procedures. We are not just going to like do once. It's not like one person examines the slide and then we just upload the algorithm to the device and then that's not universal. There's something about good laboratory practices where a standardization procedure is required, like an FDA approval or a HEPA approval and all that. Number one. Number two, and we can get Indian standards. We can get an ISO certification.
For AI?
Yes. And coming to the different things that pathologists do, not only not only seeing slides, we agree. The integration of AI with pathology also helps in easier education. There's a concept called slide library, where the slides can be given to the students as in a digitized pattern so that they can view it at their convenience at their own pace. They can zoom into it, zoom out of it, do whatever they want. Third, coming to cost, they told about our point, which we told that in a rural setup, we didn't tell in a rural setup it is monetarily beneficial to have a AI device than a pathologist. We told in a rural setup there are not pathologists available in every area. Number one.
Do you have engineers, you have the GPU, you have the internet, everything available in rural setup?
Most of it that is necessary for that area is available, but then a pathologist would be very good if they're available there. Let me finish. So coming to the cost, what I'd like to state is that there's nothing more important than a patient's life. No matter how much cash I give you, you cannot give me back a patient's life. So I don't think talking. Okay.
You said that a disease is endemic to the particular place and we have to feed the data. Where do you get to know that this disease is endemic to this place only? How do you get to know? You studied community medicine. So we are going to feed the same information to the AI. So the AI can diagnose it.
So you're telling give it to we'll ask AI. Just give the result.
Yeah, it's so simple. See, you know that Japanese encephalitis is endemic to a particular place. Okay. Now we will feed the same data, whatever you have read in the textbook, to the AI, and we will algorithm the AI to diagnose the disease in such a way that it will be 99.9% accurate. I'm not saying it as 100% accurate. Okay, this is one of the possibilities that is possible. Now you said that you are speaking only about the 1960s and 1970s, way back into the ancient times, and saying that we are developing and we should follow the same rules. We are in the era of 2030. We are approaching 2030 and we should be in a digital manner. Everything should be digitalized. So this is my argument.
So basically we are talking about AI of help, like AI helping the pathologist, not replacing pathologist. So since you talk about complex cases, so humans can only diagnose the complex cases. They can leave the simpler cases to the AI. They can put it in the machine, they can help it diagnosis and help to find the results faster. So it's not replacing pathologist, instead it's helping the pathologist to consume time and help him he can diagnose various complex cases and focus on those things and observe.
See, the thing is, y'all keep concentrating about the value of pathologists and this is how, but right now we're not talking about that. For us, importance is medical practitioners is the efficiency, accuracy of how we're diagnosing a clinical case. And also, for us, everything is patient related. So you're telling me when a pathologist is sitting and diagnosing something, he has more accuracy than AI can do. That's not correct, because you also know AI is developing and it's always going to be more accurate than a pathologist. So right now we're not saying we're going to use AI as a tool for completely replacing anyone. That's not the point. We're talking about the uses of it. So we're just using it as a tool to help them, to increase their accuracy.
And talking about security, cyber security, there is an algorithm that can, in the AI, which can help the AI itself to protect its data from getting into that cyber thing, like breaching the data from the...
Shashwat, you said about the cloud thing. So it's universal. Like all the scanners here across India, they'll have their own cloud system generator. Now the AI which will generate an image is going to be really big. Like it won't compensate in our pen drives or anything. The data is huge. But there are something called as cloud storage, where we can leverage the cloud storage. And of course there are IT technicians to help us out. It's not like you're sitting somewhere, you're stuck with the machine. The IT people sitting across the globe, anywhere, having asked, the scanner people can always guide us. So there is a hardware people involved, there's a software people involved, there's computer people involved. So all of these people will definitely help.
All these are extra costs. Hardware, software, IT professional, everything she said, that is more money you will have to pay as a pathologist when you open a lab or
Definitely, it's a job opportunity for all the hardware, software and IT people also. It's not like people will be unemployed. Implementing all these people are also one proven benefit.
And you said about like how you can't trust in a technology that's probably 10 or 20 years ahead. Did people ever think there's going to be a computer? You have one right now in your bags. You have an iPad. You have every technology right here. So you can't say like the technology will improve. You think you're going to be like this in like Stone Age. You can't obviously be like that.
Okay, so they were telling us about a lot about rural areas, how pathology can be improved there with AI. You were particularly saying that you can diagnose patients in Africa from right here. But what this is going to do is cause even more loss. You are saying it will work with the AI will work with pathologists. We are not going to be able to afford to have machine learning in our homes or in our private setups. The only companies that will be able to do this will be Google, Facebook, some Elon Musk company. So this takes power away from us into the hands of those billion-dollar companies. I will give you a live example. Everybody knows Amazon. Everybody knows Flipkart. They have destroyed mom-and-pop stores all over the world. Little people who started a shop in a little city now have nothing to do because I can get a shirt home delivered to me right now if I want, maybe tomorrow.
So she pointed about going into the future. In 1945, Henry Ford said that we'll have flying cars. Do we have flying cars? Yes. Do you see them flying? Do you see them flying?
You see them outside right now.
So there's a difference between implementation and having a dream. Dreams are good, it helps us to work towards our goals. But there is a thing called feasibility. We do not have enough money. As you said about enhancing the images and stuff, you talked about cloud. Cloud is not literally from the sky, it takes servers. It occupies massive rooms for which you have to pay money. It requires crores of rupees. Google and Facebook will take. Yes, okay. We'll talk about those as well, which creates an environment of monopoly. Now you're seeing in Bangalore that multiple hospitals have been taken up by a single company, which has the resources, which has the money to spend. What about the other nursing homes? What about the other hospitals, which were equally good? The doctors and workers, the pathologists, they do not have much opportunities to work now. They have to go for a single source.
You said your priorities, you said we are focusing on money, your priorities, patient effectiveness. We'll come back to the patients. So, until 1982, peptic ulcer disease, no one knew H. pylori was the reason. Some two people said in 1982 it could be H. pylori, people didn't believe it. Until 2005 when they were finally recognized for it. So, There are a lot of diseases, lot of conditions, lot of syndromes right now, which are in the gray area, like this. The exact etiology, the exact pathogenesis is not known. When you take into consideration these things, if you are going to continue to apply AI to diagnose these conditions also, there is a possibility in the future where a breakthrough can happen when you have an expert pathologist looking at it from his or her experience. This is something which gets hindered when you continue to use AI. And speaking of detection of cancers and things like that, there are some conditions where an expert pathologist will be able to differentiate whether it's a non-neoplastic reaction or whether it's actually something which is transforming into malignancy. No matter millions of data that you feed into AI, you are going to have a million plus one case which is going to be different, which is going to look different, which is why an expert pathologist's view comes into picture. That experience you cannot feed. You can feed intelligence, you can feed the textbook. You cannot feed that intelligence. And over time, there is going to be an over-reliance just on this. If you are going to rely completely on just AI to diagnose, then things like errors which can arise, these are things which you would have to feed into AI. So if you are also going to feed learning something wrong into it, you are going to convolute the data. And these things require a very niche field wherein someone who has equal learning in medicine and equal learning in AI and ML has to come together and integrate it. This is something which is again not feasible. A difference between possibility and feasibility.
Like you guys were talking about patients here, and they're the number one priority. Like for example, let's take someone. Why would a patient want to believe something that's machinery than a real doctor? Like, it's obvious, right? I know you're taking the help of it, but in the end of the day, you'll obviously want to trust a doctor here if you think about the patient's emotions. And the other thing is the number of protocols that have to be changed when you're trusting an AI with the diagnosis and stuff. Yeah, that's it.
Okay, we have
the similarity between all these three depends on how you communicate with it. So if you may communicate with the AI in a different manner, he may be in a different manner.
Usman, conclusive 3 minutes.
You are saying strict for pathology, but here we are talking about the patients also. So it will help in quality diagnosis. We are taking pathologists into consideration also. It's not like we are excluding them. So.
And you said that the pathologists do make errors, but the thing is with AI, we will give it like an algorithm.
Point where you mentioned about rural setups having AIs, you yourself mentioned that the pathologists are also required. Then why?
We said it's required that because pathologists are not available in that setup.
And data as well. Whoever is feeding the data, it is still a human work. So there is no.
Not the mathematician don't program
You're also spending time and knowledge and the same amount of hard work in feeding the data. Might as well use it.
Have an IT technician to do that work.
So yeah.
You can do that. It's not all its own, but it's a helping tool.
Can an AI system 100% diagnose, give us a definitive diagnosis? Yes, we can. That's the point. Yes, we can.
You get the same program. You have emotion. You're a person.
We have an IT technician for that.
Okay. Lastly, one I wanted to point it out is, she said each doctor when looks at the pathologist looks at the slide, they come to a different conclusion. That's what
she
said.
said. There's a different way of coming to
ways of coming to the same conclusion.
That's exactly what we want. That's called redundancy. We have 5 people who have different opinions, then they discuss, they come at a diagnosis. There's a singular AI which is going to give you an answer if it's yes or a no.
Singular AI will look into different
Yes or a no with an explanation as to how it arrived at yes or a no.
If you have a doubt, you can still communicate with others.
Why do you if you are coming with that point, why do you even want to spend money where it's not required? It's like employing 2 people for a job of 1.
Would you rather sit for 12 hours a day looking at a microscope?
So, you said humans can also make errors, AI can also make errors. One human will make 1 error. The data algorithm you're feeding into AI will make multiple errors. Just because of this one error that you are feeding.
You have to practice that. You can't follow that.
That's what explaining.
The integration of artificial intelligence in pathology is not merely an option, but it's a necessity for the future of healthcare. AI offers unparalleled potential to enhance the accuracy, efficiency, and accessibility of diagnostic processes. By embracing AI, we empower pathologists to focus on complex cases, research, and patient care, ultimately improving patient outcomes and reducing human error. AI in pathology is not just a technological advancement, it's a beacon of hope in the realm of healthcare. It promises to revolutionize disease diagnosis and treatment, saving countless lives and reducing the burden on healthcare systems, like in case of an outbreak or a pandemic. A multidisciplinary team of pathologists, oncologists, surgeons, and radiologists, they provide a more holistic approach to patient healthcare, and a real-time collaboration is possible with the help of AI. At the end of the day, a patient's life outweighs the cost of AI machines. It is not a question of if AI will win in pathology. It's a question of when we'll fully embrace this life-saving technology. The time for AI in pathology is now. Thank you.
In conclusion, what we would like to say is, they mentioned a beacon of hope. This beacon of hope is something you need to consider with possibility and feasibility that we pointed out earlier. There is a possibility, yes. Is it feasible? Is it required? Is it safe? Is it considering all the aspects? Is it considering the finer aspects like pervasive permeability, differentiating tissues, and integrating the other tests, integrating good history, eliciting signs, and a human touch overall that only a clinician can provide and not AI. Considering these aspects, we would like to stick to our point that right now we are not in a position where AI can be used as an aid in diagnostic pathology.
No.
Thank you everyone. The debate was wonderful and the arguments were never ending but still very interesting. So now it's time for the certificates to be distributed. I now call upon the judges to distribute the certificates. The first candidate is Mohammed Uwais.